Live from Dallas-Fort Worth, this is WFAA News.
Welcome back to Midday this Monday, May 22nd. I'm Cleo Green. Thank you so much for joining us. This hour, 8 more women are joining a lawsuit against the state of Texas over its abortion law. They claim they were denied the procedure even though they were facing medical emergencies which put their lives in jeopardy. ABC's Rachel Scott has that story.
When the Texas abortion ban went into effect, Dr. Austin Denard was so worried about the law, she struggled to even say the word.
I've had to change the way that I speak to my patients about abortion. It's even hard to say the word because you feel like you're going to get in trouble.
In July of 2022, Denard got the news she and her husband had been waiting for. They were pregnant again and thrilled. But at her 11-week ultrasound visit, something startling on the monitor.
I could tell there was something not right with the brain. And it was just a moment of, just realizing that this was not going to end up being a sibling for my children. And then I thought to myself, I can't believe I'm going to go out of state for an abortion.
Her unborn baby was diagnosed with anencephaly, a rare and fatal condition affecting the development of the brain. Still, if Denard wanted an abortion, she would have to travel out of state to get one.
Was that a difficult process? I'm an OBGYN. I understood my diagnosis. I have the means to pay for an abortion. I am the best case scenario.
Dr. Denard returned to work and continued to care for her patients, including Lauren Miller, who was expecting twins.
I was like, hopefully I won't need help planning a camping trip to Colorado.
Planning a camping trip to Colorado. Is that how the two of you were discussing traveling to get an abortion?
Mm-hmm. Correct.
In coded language.
It seems surreal.
Just a few weeks later, Miller would be facing a similar decision. 12 weeks into her pregnancy, she learned one of her twins had a rare genetic condition and would likely not survive.
It was clear I needed an abortion because every day going on, it was putting my health and our healthy twin at risk.
She ended up traveling to Colorado for an abortion. In March, Miller gave birth to one healthy baby boy, Henry, and joined a group of 7 women filing a lawsuit against the state of Texas, demanding more clarity on the portion of the law that allows women to get an abortion in emergency cases.
You just don't know what the law is. How close to dead do I have to be before I can fully access health care?
And today, 8 more women expected to join that lawsuit, including Miller's own doctor.
I want autonomy back as a woman and as a physician.